السلام عليكم ورحمة الله وبركاته. طلابنا الأعزاء، محاضرتنا عن الأورال هاليتوسيس. As the introduction, the halitosis is a general term used to define an unpleasant or offensive odor escaped from the breath regardless of whether the odor originates from the oral or non-oral source. Originates from the two Latin words halitus refers to the breath and osis refers to the disease. It shouldn't be confused with the general temporary oral odor caused by the intake of the certain foods, tobacco, or medications. This is called as the physiological halitosis, not pathological. As the classifications of the halitosis, there are three types in general: halitophobia, halitosis, and union halitosis. The union halitosis divide into pathological halitosis and physiological halitosis. Pathological halitosis can be classified into two types, oral and extraoral. But the physiological halitosis refers to the halitosis due to the food or tobacco or medications. The pathological halitosis, intraoral and extraoral halitosis. Extraoral halitosis may be due to the blood-borne or non-blood-borne. Union halitosis, it is the term that is used when the breath malodor rarely exists and can be diagnosed organoleptically or by the measurement of the responsible compound. While the pseudohalitosis, obvious breath malodor, cannot be perceived, but the patient is confused that he or she suffers from it. Halitophobia, the patient still believes that there is bad breath after the treatment of the union halitosis or diagnosis of the pseudohalitosis. Should be distinguished between these types. Pathological halitosis, intraoral, the most common, about 20% of the all halitosis. Due to poor oral hygiene, dental caries, periodontal disease, necrotizing ulcerative gingivitis, and necrotizing ulcerative periodontitis specifically, pericoronitis, dry socket, and other oral infections such as tongue cutting and oral carcinoma. The tongue cutting, due to the fount of the squamous epithelial cells, food, decrease bacteria, and salivary proteins, and provide ideal environment for the generations of the volatile silver compound that represents the main source of the halitosis in the oral cavity. Extraoral origin represents about 10% only. From the 10%, only 10 to 20% of the gastrointestinal tract. Another percent infections or malignancy in the respiratory tract, chronic sinusitis and tonsillitis, stomach, intestinal, liver, or kidney affected by the systemic disease. The most common causes of the halitosis, local or systemic. Local, such as oral disease, periodontal disease, and respiratory disease, sinusitis, or volatile food thefts, such as onion. Systematic disease or causes such as diabetes mellitus. Etiology or pathway of the halitosis. There are two pathways of the bad odor or halitosis. The first one involves the increase in the certain metabolites in the blood circulation due to the systemic disease such as diabetic mellitus, which will escape by the alveoli of the lungs during the breathing due to the blood gas exchange. While the second pathway arises as a result of the bacterial decomposition of the food particle cells or blood and some chemical compounds, specifically volatile sulfur compound and non-silver containing substances. The role of volatile sulfur compound in the pathogenesis of the halitosis due to the increased permeability of the oral mucosa and cervical epithelium. Also, oxygen utilizations by the host cells react to the cellular proteins and interference with the collagen maturations that increase the collagen solubility and secretions of the collagenase prostaglandin from fibroblast. Or due to the decreased DNA synthesis and the intracellular pH inhibit the cell growth and periodontal cell migration. The diagnosis, a lot of can be used. The first one, full history from the patients or self-examination test, subjective test, cavity breath, such as and the figures, and third, the objective test halimeters. This is represent a device that can be measures the halitosis, and prevention measurements can be used the dentist regular visits and performed oral hygiene instructions, limited intake of the strong other speeches. Management of the halitosis or can be decrease the pad in the oral cavity, mechanical reductions of the intraoral nutrients and microorganisms, also chemical reductions of the oral microbial load, conversion of the volatile silver compound by the zinc, replace the volatile silver compound, or masking malodor by the use mouth spray to and especially that contain herbal. Thank you very much, and the best welcome for the all students for the next lectures, inshallah.